Hello, I am Khandakar Ahmed Kaisar. I am describing about Dr. Zafrullah Chaudhary. Dr. Zafrullah Chaudhary forgave to independence by leading the armed force against the Pakistani. His contribution of the Great Liberation War as well as the healthcare will be re- remembered. Zafrullah, who devoted himself to the service of the freedom fighter by establishing a field hospital in 1971, made a major contribution of formulating a national drug policy. His contribution is also remembered for establishing the public health center, providing medical service to the poor at low cost. Zafrullah was come to contact with Bangabandhu, was also playing various roles of the politics area. However, the time the became known as the crisis of the Awami League government before the 2008 parliament election. Zafrullah Chaudhary played a role in the building of the Jatiya ঐক্য Front by the bringing the opposition parties together. Zafrullah Chaudhary was born on December 27, 1941 in Raujan, Chattogram district. After he passed the school, he go to the Dhaka College for HSC. He did his MBBS from the Dhaka Medical College in 1964. After he went to the United Kingdom for higher education, but after the beginning of the Liberation War, in 1971, abroaded his studies and rushed into this country. After returning from the London, Zafrullah was received guerrilla training from the training center of Meghalaya, Agartala, India. Later, he dedicated himself of the service of the freedom fighter by establishing the Bangabandhu Field Hospital there. His great role is still remembered by the freedom fighters. After independence, Zafrullah Chaudhary brought to Field Hospital at Meghalaya in India Iskaton in Dhaka. Later, the hospital was satisfied to serve at the slogan. Let's go to the village to make his village to central of the development. There was the named Ganashastha Kendra. After independence, almost half of the staff of public health center were recruited from the women. Zafrullah Chaudhary was a member of the National Education Committee and Women's Committee since 1979. He contributed to formula of the national drug policy in 1982. Drug of the COVID-19 pandemic, he took at the introduction of the independent simple testing kit from the public health and contributed the COVID situations. Dr. Zafrullah Chaudhary named this the main satisfaction level of the health side. Dr. Zafrullah and the public health faculty should be together and named Ganashastha Kendra Bangabandhu First Hospital is now well known for the population control work. For the instruction received the Independence Medal of the National High Honor Public Health and Medical Concert are 40 nationals and who recognize community-based medical schools. It is 17 hospitals and density colleges in public university printing publishing service in monthly public area. Dr. Zafrullah was to see Bangladesh is a liberal democracy country to see the acceptable and fair election in the future, but he couldn't not see. It is the struggle enough to contribute to the minimum health system of the people and the established democracy right. The common man will be thankful for the medical policy to be formulated and the maintain will be grateful for this visible contribution. How devoted Zafrullah was the welfare of the people cannot be understood without seeing the institution. Ganashastha Kendra Hospital is seen the providing the cheap health care to the common man, especially for those suffering from complex kindly disease, cheap dialysis and several Ganashastra and Shamas based medical college and public pharmaceutical and public university. All these are available to common and poor people. This is why Zafrullah will remain the shining star of the people of the doctor, and he is the main person to establish the health society in my country in Bangladesh. So this is the main support to our health margin, and he is the main pillar of our health industry. Thank you.